Hi, welcome to Medicare Monday. Today's recording is being pre-recorded, and it is about Medicare and home health care. What is Medicare and home health care? Home health care includes a wide range of health and social services delivered in your home to treat an injury or an illness. Services covered by Medicare home health benefits include intermittent skilled nursing care, therapy, and some care provided by a home health aide. Medicare will cover home health care by the following 4 steps. 1, you must be homebound. 2, you must also need either or both skilled nursing services or skilled therapy care on an intimate basis. You must have a face-to-face meeting with a doctor within the 90 days before you start home health care, or 30 days after the first day you receive the home health care. This can be an office visit, a hospital visit, or certain circumstances, or maybe even a telemedicine visit. Your doctor must sign a home health certification confirming that you are homebound and you need intermittent care, that your doctor has approved a plan of care for you, and that the face-to-face requirement was met. To continue receiving home health care, your doctor should review and certify your plan of care every 60 days. A face-to-face meeting is not required for this recertification process. And finally, for Medicare to cover your home health care services, you must receive it from a Medicare certified home health care agency, otherwise known as HHA. Some of the services that home health care covers under Medicare would be skilled nursing services. These are services performed by or under a supervision of a licensed or certified nurse to treat your injury or illness. There's skilled therapy services. These are physical and speech and occupational therapy services that are reasonable and necessary for treating your illness or injury. And home health aides. Medicare pays for an aide if you required skilled nursing or therapy services. A home health aide provides personal care services, including help with bathing, toileting, and dressing. Medicare may not pay for an aide if you are only requiring personal care and do not need the skilled nursing or therapy services in the first place. Other items that Medicare home health care cover would be medical social services. That's if you qualify for home health. Medicare pays for services ordered by your doctor to help you with social and emotional concerns related to your illness. Home health services also cover medical supplies. Medicare pays in full for certain medical supplies, such as wound care, dressing, catheters, when provided by a Medicare certified home health agency. It also covers durable medical equipment. Medicare pays 80% of the approved amount for coinsurance charges, as long as your home health agency accepts Medicare approved amount for your DME items as paid in full. DME is called durable medical equipment. How much will home health care cost? Well, Medicare home health covers skilled nursing care and home health aside aid services provided up to the following: 7 days per week for no more than 8 hours per day and 28 hours per week. If you need additional care, Medicare provides up to 35 hours on a case-by-case basis. You can continue to receive home health care for as long as you qualify. However, your plan of care must be recertified every 60 days by the doctor. If you have Medicare and a original Medicare and your home health agency decides to reduce services prescribed by your doctor because it believes that Medicare will no longer cover these services, it should give you a notice explaining why services are being reduced. This is called a home health advanced beneficiary notice. This notice asks you to choose one of the following three options. 1, request care and ask the home health agency to bill Medicare, meaning demand bill. If Medicare denies coverage, you have a right to file an appeal. If your appeal is unsuccessful, you may be responsible for the cost of care. Home health agency may refuse to demand bill. Number 2, request care but agree to pay the care out of pocket. And number 3, turn down the care. You can look for other home health agencies that might cover your needs. What happens if the home health agency reduces the services? Your doctor reduces the amount of care in your care plan. In this case, you will need to get your doctor to change their minds, or you can try to find another doctor who will certify you to continue getting the same number of services. The home health agency reduces your care for staffing reasons, or they do not think it is safe for you to stay at home. You will need to find another home health agency to get that care. Investigate other care options in your community or go without these services. If you have a Medicare Advantage plan and your home health agency is reducing your home health services because it believes your plan will no longer cover these services, you typically need to ask your plan for a fast, expedited review of this decision. For more information, make sure you contact your plan. If your home health care is ending because your provider believes Medicare will not pay for it, you should receive a notice of Medicare non-coverage. You should get this notice no later than 2 days before your care is set to end. If you receive home health care, you should receive the notice on your second to the last care visit. If you have reached the limit in your care and do not qualify for care, you do not receive this notice and you cannot appeal. If you feel your case should continue, follow the instructions on a notice of Medicare non-coverage to file an expedited appeal with the Quality Improvement Organization by noon of the day before your care is set to end. If you have original Medicare, the QIO should make a decision no later than 2 days after your care is set to end. Your provider cannot bill you before the QIO makes a decision. If you have a Medicare Advantage plan, the QIO should make a decision no later than the day your care is set to end. Your provider cannot bill you before the QIO makes that decision again. What does Medicare not cover in home health care? It does not cover 24-hour day care. It does not cover prescription drugs that are enrolled in the Part D plan or a Medicare Advantage plan. It does not cover meals delivered to your home, and it does not cover custodial care. That's homemaker service, which might include like housekeeping, laundry, meal preparation. That is not part of your care plan. Home health aides may perform some custodial care when visiting to provide other health-related services. However, aides cannot visit for the sole purpose of performing custodial duties. Medicare home health care fraud. To prevent and detect home health fraud, you can protect your Medicare number and read your Medicare summary notice when you receive them. If you have original Medicare, you should receive a Medicare summary notice every 4 months. If you have a Medicare Advantage plan, you should receive an exclamation explanation of benefits each month. Here are some examples of potential home health fraud or abuse to watch for. You see charges on your Medicare summary notice or explanation of benefits for services you did not receive. You are enrolled in home health services by a doctor that you don't know. A home health agency offers you free groceries or free transportation. You're charged a co-payment for home health services. You are asked to sign forms saying that you received home health services that you did not receive. If you think you have experienced potential Medicare fraud, errors, or abuse, you should contact the Rhode Island Senior Medicare Patrol at 1-888-884-8721. This following chart is about our all of our partners that can help you. If you want to find the closest partner to the area you live, they are considered Tri-County Community Action North, Johnston Senior Center, West Bay Community Action, South Kingstown Senior Center, Westerly Senior Center, The Point, East Bay Community Action Agency, Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, the Edward King House in Newport, and you can also call our 1-800 number, the Rhode Island State SMP line at 1-888-884-8721. Thank you for attending today's session. If you have any questions or concerns, you can feel free to call me, email me at the following information.